I'm Dr. Gavin Norton, originally from Indiana. Go Irish. Since relocating to Kansas City in 2015, I've embraced significant life changes, including being married, starting a family, and completing chiropractic school. During my academic journey, I discovered the opportunity to become a spine management physician, and recognizing the value of collaborative care, I eagerly pursued this opportunity to enhance patient well-being and working closely with other providers. I successfully applied to the program, making me the inaugural resident and one of the first in the chiropractic profession. Over the next 2 years, I'll be under the guidance of Dr. Myler while completing rotations in primary care, orthopedic surgery, neurosurgery, both spine and extremity, radiology, advanced imaging, and pain management. I look forward to meeting you and being a part of your journey. Stay tuned for more information on the Spine Management Physician Residency Program.
I'm very excited about the prospects of bringing a residency training program to the profession of chiropractic. I think that it's been needed for a long time. As I look back at my own medical training and consider where I was at the end of 4 years of medical school, would I have been ready to treat patients? And the answer is not really. The real learning for me happened in my residency training in neurosurgery. And then there was another level of learning that happened once I finished my residency training and got into practice and worked with mentors and was able to be part of a network of surgeons to continue to ask questions and learn. And I think that that model is highly needed in the field of chiropractic, where there's an opportunity to get advanced residency training to be prepared to take your practice abilities to the next level.
National Spine Management is offering chiropractors an opportunity to be involved in a residency, and the goal of that residency is to improve their diagnostic skills, how they interact in the healthcare place, and really make them a more well-rounded healthcare provider. I think education and furthering education is really the key to becoming an integral part of the healthcare team, of which chiropractors have been for a very long time.
The residency program is vital to our profession. It's starting to be in different fields, but highly encourage anybody to understand how vital it is to have that education. The National Spine Management Group and the residency program is top-notch, patterned after a medical school residency with board members that have been through that process. And those experiences help us with the challenges that we go through, but it's a very important part of the healthcare and a need to become that spine management provider.
Another benefit of the program is the relationships that are built with other people who have similar background and training or are further along in this type of thinking, and being able to share cases with each other, to meet at conferences, to pick up the phone and call somebody and say, what do you think about this case? And I think that that is such an important part of medicine and medical care, is that collaboration and networking that can occur when you have gone through a training program with other colleagues and are connected to a system of providers that are there to help you.
Receive hundreds of hours in training in advanced imaging, triage, understanding documentation and compliant reporting, and ultimately getting through and rotating with all of the specialists that we're going to interact with on a regular basis.
A trained spine management provider is a good idea and very much needed. And who better than a chiropractic graduate, somebody that's already been trained and understand the spine and what's needed to coordinate spine services. It is also an excellent opportunity to eliminate the unnecessary costs that come from unnecessary tests, treatments, and procedures.
I think there's a big difference in someone who is in spine management versus a chiropractor. I think someone with spine management is going to look at all of the factors rather just the spine, whether that's looking at how the feet are operating or the shoulders or the arms or things like that. It helps provide attention to all of the other elements of just rather than just making adjustments and just the spine. Having a team of multiple people that are always honing in on exactly what the individual needs, that's what makes something great. It's what helps me become great.
I think the National Spine Management Program offers chiropractors an incredible opportunity to further their skills and develop into even greater healthcare providers. The reality is that your training in chiropractic care was very thorough with both clinical work and didactic study, but when you interact in the healthcare team, you'll see patient care from everybody's perspective, whether that's a surgeon's perspective, the trauma doctor's perspective, an ER doctor's perspective, and also the input from nurses. And that understanding of what every person in that team is doing will help you to become a better provider.
Looking at the biomechanics in a different way and understanding and learning that is something that it's just not able to be learned in chiropractic school. There's so much to learn, and you can only learn so much in a setting.
It is more evident to me that we really need spine management to help us coordinate and help guide patients through their care, because none of the subspecialists currently are able to perform that service adequately.
Thank you so much for watching this short video. My information is listed below. Please reach out if you have any questions or concerns. I would love to chat. Thank you.